This patient came to see me because she was dealing with some sinus issues on the upper right. So she said it could be a tooth issue. We did a 2D image. We didn't see much, so we decided to do a limited field of view 3D CBCT. We can see there is some bone loss associated with the pathology here on that buccal aspect, and also look at this palate aspect, look at this bone defect. And this is all due to the diagnosis of what's going on in the tooth, which is a necrotic pulp with chronic apical peritonitis. Look at all this bone destruction in the sinus floor. So when we have a case like this, it's very important to be able to understand that we are dealing with a tooth issue and not a sinus issue. There are a lot of patients go to an ENT, get antibiotics, and also get sinus surgery unnecessarily because it is a tooth-related issue. You can see the pathology here on the buccal roots and also the palatal roots here. You can see that palatal root with all the bone destruction. So we did this in one visit. Notice there were 4 canals, all had separate portals of exits. So we brought the patient back in 6 months. Look at this beautiful healing. Almost 100% of that bone has came back on the buccal aspect. We can see up into the sinus floor. The bone is remodeling there. On that palatal aspect where we saw that defect, the bone is filling in there as well. So when we have cases like this, these cases can be done in one visit using bioceramic sealer and also single cone condensation. And like I said, it's very important to understand this is not a sinus issue. This is a tooth issue. And once we did the treatment, after a couple of days, all the symptoms related to her tooth and her sinuses actually went away. So this is a 6-month recall showing beautiful healing on cases like this. So this is before and after. So we have cases like this. You may want to communicate this to an ENT and check out my textbook, Endodontic Keys and Cases.